Hey, if you've been having problems with vertigo and you've tried medications and you've tried all the maneuvers online, join me today as I talk about one of the cases that we manage in our office and how we wind up managing it. I'm Dr. Gregg Gerstin, and I'm a chiropractor that focuses on optimal health and wellness here in Northbrook, Illinois. And I've shared this patient's story with you in the past. She came into our office having had unrelenting headaches across the base of her skull. As we went through and we did our examination and our history, she shared with me that she had had a 6-year history of vertigo episodes. That was her first one. Then as we went through and she actually went home, she thought to with her husband, and she had actually had a cycling accident where she went end over end on the bike, knocked her head, and got a concussion. She kind of forgot about that. We usually can forget about traumas, but that's not really the point. What happens though with that is that our brain does get injured or our brain gets off, and the changes can happen in our neck. The neck's designed to absorb the shock from a trauma. And when the spine can't absorb shock from a trauma, it winds up getting elongated and changed position. So if we looked at this patient, we can see that instead of having a normal arc of a 42-degree cervical curve, you can see the red lines that I've denoted here on the posterior elements of her body create an S shape, where her spine shifts forward and she no longer has the arch that helps to keep her strong. This has finally caused her to break down and have headaches, which have caused also the vertigo and may have been caused from the trauma from the bike, or she's a previous volleyball player competitively through high school and college, and any of the impacts from that could have caused it. Now, I'm not here to look at which one caused it, but what I am here to look at is this is a problem that's been building for a long time. Just like your vertigo has probably been building for a long time, or the symptoms related to it have. It's just knocked you on your butt recently. Understanding this shape and configuration is the key to making sure that you never have an episode again. Because if we just do maneuvers or we take medication and we don't take care of the cause of the problem, we're missing a ton of what's going on. And most often the key to the problem is the area right here in your brainstem called the vestibular centers. And they receive input from 4 major components within your spine and your body. And what I'm going to do is connect you to a video up here that we actually focus on that and that only. So make sure you check that out if you want to understand it. For this case, we worked on managing the crisis, and she's out of headache pain. It's only been 2 weeks, which is super amazing. Then what we look to do is determine, can we make a correction to the cervical curve? What we did here was we had her lay on a device called a cervical dental. This is a cervical orthotic that needs to be prescribed, and it looks like this. We wound up utilizing it, and there is a screw in here so I can teach her how to use this. And we placed it right at C4 where the spine begins to flip. What we can see is that her cervical curve is extremely flexible still, and she should be able to achieve a full correction if she follows our recommendation. This is a great sign for her and her ability to wind up healing from this. But if you've been having problems, you may not be able to. And every time you have an episode, these problems become that much closer to permanent. If you're concerned about your spine or someone who you know who's gone through vertigo, make sure to share this video with them. Feel free to as well write your questions down below. I spend hours every week combing through those to find the answers for you and find the best resources so that you can get the help that you need. Now, once again, if you've got questions about this, write down below. And if you need help, go ahead and ask. Lastly, if you like videos like this and following stories, which I'll do follow-ups later on with her as she remodels her spine, go ahead and subscribe to our channel. We're constantly bringing you content like this. Once again, I'm Dr. Gregg Gerstin, and thank you for letting me be a part of your health.